What's up, ladies and gentlemen? Welcome back to New Sketch with Dr. Ken. But if this is the first time you've seen this channel, don't forget to subscribe. Welcome to Histology Practical Question Series, and today I have a more of techniques that are going to help you if you're going to approach the GIT examination, the GIT histological examination question. So these are the things that you're going to put in mind. These are the things that will make it easy for you to identify the structure and to name under a minute, because remember, given only 1 minute, you ask you to name the the tissue and the other questions that might be applicable to that question. Okay, so I think number one thing that you should come in your mind is to identify the epithelium type. What is the epithelium lining? So for example, if it's stratified squamous, stratified squamous, so it's a squamous in layers, and then the top cells, they do not have nuclei, so that's going to be in the non-keratinized stratified squamous epithelium. So it clicks in your mind, okay, this is non-stratified squamous epithelium. You keep in your mind, it might be asked there, yes, you put that this is non-keratinized squamous epithelium, non-keratinized stratified squamous epithelium. And then because you already know the epithelium type, you're gonna know the location. Okay, so because non-stratified squamous epithelium, non-keratinized stratified squamous epithelium is either found in the oral cavity, the gastric, the esophageal mucosa, or the anal canal. So it clicks in your mind, and then you're going to ask yourself, do I see villi in this question? Do I see the villi in this question? If yes, then definitely I know, okay, this is gonna be in the intestine. But if I don't see the villi, I'm canceling the intestines. So I'm remaining with the other parts of the gastrointestinal tract, the tract of the GI, the gastrointestinal tract. And then the next question you're gonna ask yourself, do I see glands or not? So if you see glands, it's more of the the gastric glands. So they are more, this tissue most likely coming from the stomach. Most likely from the stomach, because the stomach will have the glands, but also the epithelium type will guide you. Okay, because the epithelium of the stomach is going to be the simple columna. Simple columna. But you have simple columna, do they have villi? Or if you have villi, we go straight to the intestine. But we don't see villi, we see glands. So we go where? To the stomach. And then I'm going to also to see the lymphoid tissue. The lymphoid tissue are more of the intestinal. Most of the intestine has got this lymphoid tissue. And remember, your Peyer's patches is also found in the intestine. Is going to help in lymphoid tissue. And then next question that you're going to ask yourself is, do I see the muscles? Do I see the muscles? Because remember the areas of the gastric mucosa. Of the GIT, like we have the mucosa, we have submucosa, you have the muscularis externa and the serosa. Do I see the muscles? And this is going to change the way you are thinking about your tissue. So when I'm taking you to a tissue of gastrointestinal tract, this is a question that should pop up in your mind. And then once you know all this, you're definitely going to knock it out. And this is my opinion. So see you into the next question.